So this award came at a perfect time in my career. I have been on the faculty here at the University of Utah for about 5 years, and I was really in a position where I wanted to make the next step forward in my career, and I needed help to escalate and elevate my research career. And the Women as One opportunity came along, and I saw it was a network of powerful, connected women who were very motivated, like me, to help advance women in academic cardiology. And I can already see how it's going to be an exceptional resource to help me advance my research career and my clinical career as well. Another reason I applied is because to do this successfully, you really need to be a part of a team. Nobody can succeed at a research career alone. You need to be networked, you need to have friends, and you need to do it in collaboration with other people. And I think for many of us, women in academic cardiology, that environment and that support can sometimes be missing. So with a network of women like the Women and Women as One, I think we're going to be able to develop that sort of relationship, collaboration, and support to help our careers well beyond this year of the award. For as long as I can remember, I have been passionate about data. I love data. I remember back in 2011, I was sitting at a table at a meeting, and I remember saying to one of the mentors, "Gosh, there's just so much data we collect every time we see patients. Why can't we predict things? Who's going to have a heart attack? Who's going to get heart failure?" And at that time, it hadn't really quite gotten into vogue, the idea of data science, but I stuck with it. And what I've learned now is that a reason why we hadn't been able to do it before, one of many, is that we didn't have clinical experts who were driving the data science ship. You really need to know something about the field, about the patients, to create useful tools from data in healthcare. So everyone hears buzzwords about artificial intelligence and machine learning. The algorithms behind those are one thing, but really understanding the problem and connecting the dots between the computer science folks and the clinical folks is critical. In line with my interest in data science and creating tools that are actually helpful to patients, one barrier is that if you build an algorithm, if you build a tool, it needs to be implemented, given to the clinician or given to the patient in a way that is useful. So one project we're working on is characterizing blood pressure phenotypes. What does that mean? So in the course of treatment, patients will have multiple blood pressures measured. The issue here is that there is a lot of variability in patients' blood pressures and their response to that blood pressure. And if we have 7 million measurements, how do we use that data to create phenotypes, as in patients who will benefit from a certain blood pressure treatment strategy versus patients who will benefit maybe from a different blood pressure treatment strategy? So we're going to use some computational methods called dynamic time warping to characterize these blood pressures and try to find groups that could potentially benefit from different types of blood pressure interventions and improve their cardiovascular outcomes related to atrial fibrillation. One barrier I've had here is that when we develop these sorts of tools, we need to implement it. We need it to be delivered to the clinician and the patient in a way they can use. We need to develop an interface. And that takes a certain amount of skill, and I'll be able to use these funds to help me build out my team, developing the tools, developing the delivery, and also implementing it. And the Women as One award is going to help me reach these goals. In today's climate, of course we have to worry about COVID-19. Of course we have to worry about systemic racism. The skills I've gained through the course of my 5 years in my training have helped me in both these areas, actually. As I mentioned before, the data science tools and methods we're developing related to blood pressure and atrial fibrillation, the goal is to develop tools that are going to help our vulnerable populations, including racial and ethnic minorities, including our rural populations here in Utah. And another thing we've been able to do is use our phenotyping methods to create a pretty detailed cohort of COVID patients here at the University of Utah. And we're going to be able to use that to study and learn a lot about this condition when we combine our computable phenotype approach to other methods like biomarkers, genotyping, and develop a collaborative team to make this work happen. Before all this happened, the things that kept me up at night were really about delivering value in healthcare. A lot of what we do might not actually benefit the patient. And hopefully with some of the tools we're developing, we can find the right treatments for the right patients and get better at delivering care in a way that really matters. I think a critical thing we've learned over the past few months is that we're going to develop some artificial intelligence, machine learning type tools, but ultimately what we need are randomized control trials. This area of COVID has made that abundantly clear. The only way you prove if something works or not is the randomized trial. So traditionally that's been for pharmaceutical or maybe procedural interventions. There has not yet been much in this sort of software development, algorithm development world, but we actually need it. If I develop a blood pressure phenotyping tool that helps a clinician and patient decide how they're going to treat their atrial fibrillation, we need to test that in a clinical trial. And insisting that happens is one important way to move this field forward with respect to data science. Well, obviously, the Women as One organization has supported my career immensely. But before this, I've had some pretty excellent sponsors and mentors. I will say there are the very obvious things people do to support your career. They recommend you for an award, they suggest you maybe to write an editorial, but there are the more subtle things which are not that visible but end up being really quite important. Something that I've learned is that when there are opportunities to promote another woman, you have to do it. And I've had that for me. We've had grand round speakers come who are women, and that person will say something very positive about me to my boss or the leadership here. And that creates an impression about you that is really important in developing your reputation and your network. So there are the explicit things and the obvious things, and then there are the more subtle things, both of which are equally important. Hands down, my favorite hobby is tennis. I love to play tennis. I would do it all the time if I could. Although I will say, now that I live in Utah, I am going to learn to ski. So I've been here for, as I said, about 5 years, and the first 4 years I was either pregnant or nursing, so I didn't learn. But this year I did it. I bought some skis, and just like I'm going to conquer this research world, I'm going to conquer that mountain and be able to ski down anything. And just like my research career, it's going to take a couple of decades to get there, but I'm sure I can do it. I make a clear effort to always remind myself, is what I'm doing, does it actually matter? Beyond papers and grants, is it going to help a patient? So I really keep that vision in mind, and hopefully what I can say I've done is created something, help our vulnerable populations, improve their cardiovascular outcomes, and help them live a long, healthy life. Another goal I have is to change something about the field itself. The way we execute studies, the way we do clinical trials. We can use these data science tools that are at our disposal much more, I think, than we have to create some efficiency. And because of that, that will allow us to answer many more clinical questions that maybe before we were not able to answer, because clinical trials are a big, long, expensive endeavor. We really need a confluence of clinical experts, computer science experts, and hopefully people like me who have some experience in both to really advance our field and create something that matters.